Good morning, Cesar Victora, Emeritus Professor at University Federal of Pelotas in Brazil. It's a pleasure to have you with us this morning at our series Leader in Action at IDRC. I'm Jean Lebel, and I'm the President of the International Development Research Center here in Ottawa. And today I have the great pleasure to be with Cesar. Cesar will deliver a talk later today as the recipient of the John Durkins Awards on Global Health from the Gairdner Foundation based in Toronto, Canada, which represent the largest prize, I think, in terms of prestige, but also in terms of money for anyone involved in global health. And Cesar has been the recipient this year. Congratulations for that, Cesar. Before we get into the topic of discussion, which I think is the flagship work that you have done on breastfeeding and impact of breastfeeding on children from birth up to today, because this is probably one of the most famous cohort study in the world that you started in 1982. I'm going to ask you, as a child, who were you and what drove you to start working on these type of topics?
Well, I always liked maths very much, and I was pretty good at school in mathematics, and I always thought I would be a physicist or an engineer or possibly a nuclear physicist. That's what I had in mind when I was young. But then during my adolescence, I started becoming worried about social issues, and you know, Brazil is one of the most unequal countries in the world in terms of the distribution of income. And I thought I needed to do something different. And then I went into medicine. Well, naturally, within medicine, I went into epidemiology, which is the part that is the hard science of the statistical arm of medicine. And that's how I became interested in these issues in public health and in epidemiology and started doing research.
But that's part of the story, because you know it was community health, so you were linking, you know, the social movement that was taking place in Brazil at the time, particularly in the South, in tough time. But you link it also to an issue that was really not really well known. So what drove you initially to breastfeeding?
Well, I was working, you know, when I trained in medicine, I was working in slum areas in the south of Brazil. And it really struck me that I was seeing the same children brought to me over and over again with the similar problems, with diarrhea, with pneumonia, with measles, with malnutrition. And I also realized that largely because of the promotion of infant formula as being more modern and more appropriate for feeding infants. The average duration of breastfeeding in Brazil at that time was 2.5 months, which is very, very short. And breastfeeding, I said, if you can only show that breastfeeding can prevent mortality and have, you know, good data showing that, then we can promote it. And it's cheap, you know, it's free. It's safe, it's biologically safe, and it's perfect nutrition for young infants. And then that's why I said, why don't I try doing research on breastfeeding to see if I can help promote this practice.
And what our audience don't know, and I've learned because you very elegantly cite the support of IDRC when you received the award last fall in Toronto. And going back to the file, what we discover is that one of our former employees, the late Carl Smith, met you and your colleague in Pelotas back in 1982 and provided the initial support. You mentioned to me that you were asking for 25,000 and we gave you 40,000. So, you know, let's say that this was a good investment. But how come you met with someone from IDRC, or someone from IDRC found you in Pelotas, which is, you know, 4-hour bus ride to Porto Alegre, then, you know, the flight to Sao Paulo, then the flight to the world. So how did you do that in 1982?
Yes, it was largely done by my colleague Fernando Barros, who has been my partner in terms of work and research for 40 years now. And Fernando found a note in a medical journal saying, you know, IDRC promotes research and development issues, including public health. And then out of the blue, he wrote to IDRC. And we got this very positive response. He said, no, we're coming to see you. And say, whoa, wow, these guys are coming all the way from Canada to Pelotas. You know, it's a 27-hour trip if you include everything. And then the Carl Smith landed in Pelotas, and the work was shown to him by Fernando. And Fernando said, we need $25,000 to start this birth cohort of 6,000 children. You know, I mean, and Carl looked at it and looked at the budget and said, no, you need 40,000 at least. And that was the first grant we got from IDRC. And later we got a second grant which funded a separate study, which was the one on breastfeeding and infant mortality. Yeah. And then we got a third grant because IDRC helped us set up a network of Latin American researchers interested in early life. Yes.
So let's jump forward. You know, you have about 6,000 participants in a cohort, and the cohort look over time what is happening.
Yes.
This cohort still exists. Yes. So, you know, we won't get into the detail of maintaining the logistic of following, you know, people for 35 years. But what has been the main finding? You know, if you had 2-3 main findings, what were they over all these years before, you know, not before, but as it became, you know, the golden standard for breastfeeding and its impact around the world?
Yes, I think if I had to summarize the main finding is the importance of the first 1,000 days on the life course. The first 1,000 days include 270 days of gestation, that is 9 months, plus 2 times 365, which is the first 2 years of life. So from conception to the second birthday is when an individual is basically formed in terms of nutrition, in terms of brain development, in terms of development of the pancreas, the kidneys, the liver. So what we're finding out, along with many other researchers in the world, but our advantage is that we are the largest and longest cohort in a developing country. Yeah. There are lots of cohorts in Europe, US, Canada, England, and so on. But what we're finding out is how important these first 1,000 days are, not only for short-term health. I mean, a child has to be well-nourished in order to survive, but also for brain development and for long-term incidence of chronic diseases, like heart disease, like some cancers. They are largely determined in this critical window of time, the first 1,000 days. And this concept has really been incorporated now by many initiatives, and we're happy to be part of the database that has ensure that such evidence is now transformed into policy, meaning better nutrition, better stimulation programs for young children.
Yeah, because I think often, even here in Canada, we don't realize that, you know, when WHO came with their standard or comes with standard, it's always based on good science. And in this case, particularly of breastfeeding, the first 1,000 days, the critical, you know, development of children, but the impact afterward that are demonstrated and are positive, it roots itself in the work that you did in Brazil, that others have done elsewhere, but fundamentally you were the first on the mark, and that's quite remarkable. Let's jump to the policy development. You know, you were mentioning, you know, Brazil's situation with a lot of inequality.
Yes.
And we know that this is probably the biggest challenge of our time. Those inequality are global. It's not only the North, it's not only the South, it's everyone that is having this challenge. How do we, you know, bring the reality that we can beat those inequality by having the proper policy at a broader scale? How would you do that?
Yes, well, I can tell you a bit about the Brazil experience in the last 20 years or so. We were the #1 country in terms of income inequalities in the world, and now I believe we're number 12 or 13, which has been we're getting a little better. We're still very unequal, but we're getting a little better. But there were a number, the important thing about inequalities in health is that they cannot only be solved within the health sector. They need multi-sectoral policies and interventions. But we in the health sector have to realize that we are part of the problem, because the way we deploy our services, because of the barriers for accessing services, either economic barriers or distance related barriers, these compounds the inequality problem. And so we have to start looking within the health sector, see what can we do to remove these barriers that prevent the poorest children from having access to services. And but we also need to work with education, with cash transfers, with communications, employment. So you need a multi-sectoral approach to resolve the issue of poverty and therefore improve the health of children. And into this also, you know, and you proved it with breastfeeding, which is essentially formally a woman, you know, involvement, but also a family involvement, because I think that is demonstrated also that it's not only about the women, but it's also about the support that you get. You demonstrated that, you know, yes, complex issue can be looked at, can be tackled. It takes time, it takes research, it needs good translation into policy, and it can have a global influence. Cesar, you know, you have been around for so many years. You have been one of the leaders at the table that, you know, has the most remarkable career. And as someone that have seen numbers of, you know, different situations in the world of research, what would you say to a young researcher coming to the field? You know, what would it be that you will tell him or her about what to do, and what are the key principles to have such a successful career? Well, I think there are three things that I would tell a young scientist. Number one, find a topic that you're passionate about, that you really care about, that is close to your heart. That helps, because that will drive you. Number two, get training on rigorous research methods. You may find a fantastic topic, but if your research is not rigorous enough, it's going to be ignored. And do that research. And number three, never give up. I mean, even if IDRC had not given us the $40,000 in '82, we would still have continued with a shoestring budget, but we wouldn't have given up. And then many times in my career, I felt like giving up because something was not, you know, I wasn't getting the funding, or a paper was being rejected, but I continued, and I'm really happy I did so. So that's my advice to young scientists. So it's about persistence and resilience. Yes, exactly. And that has been something that we have learned from our mentor, like Carl Smith, that you know, set the path on how to find people like you that are innovative, creative, and that are thinking a little bit outside in the margin of the problem in order to resolve it. And you have demonstrated this in spades throughout your career. So thank you very much for having me with us. Thank you, Cesar.